You've been reading podiatrist reviews near South Orange County, trying to figure out which doctor to trust. You're doing the right thing in the wrong place. Online reviews will tell you lots of things. They won't tell you the one thing that determines whether your outcome is good. At Podiatry Hotline Foot and Ankle in South Orange County, patients arrive after spending months working through review-based selection processes that land them at the wrong type of provider. With 25 years practicing in the same area, double board certification in podiatric surgery and wound care, Dr. Thomas Rambacher treats the cases other doctors couldn't solve. Not because he got lucky, but because his training and diagnostic process are different in a way that doesn't show up in a Google review. We're going to cover what reviews actually measure, what they consistently miss, the 3 clinical markers that predict whether a foot doctor in South Orange County is the right specialist for a serious case, and then a simple process you can run through tonight to evaluate any provider before you book. Most people treat a high rating as a proxy for clinical quality. 4.8 stars across 200 reviews means this doctor is good. That's a natural conclusion from the way the review platform works. They aggregate satisfaction, and satisfaction should correlate with quality. Patient satisfaction and clinical quality are related, but they're not the same thing. A provider can have a warm demeanor, an efficient check-in process, a staff who calls to follow up, and still be a generalist who applies 1 or 2 standards across every foot complaint, regardless of complexity. Reviews capture the experience of being in the office. They rarely capture whether the right diagnosis was made, whether the full range of treatment options were considered, and whether the problem was resolved rather than managed. A patient who receives a 5-star office experience, but an amputation that could have been avoided, isn't going to write a review explaining that the specialist lacks limb salvage training. They don't know enough to name what went wrong. They just know the outcome wasn't what they hoped for. Reviews are a floor, not a ceiling. A practice with consistent 1-star reviews has a problem. A practice with consistent 5-star listings has earned your attention, but not yet your booking. The clinical question comes next, and they're not in the reviews. They require one additional step that most people skip entirely. So what are the clinical markers that the reviews aren't capturing, and how do you find them? Most patients evaluate a foot doctor the same way they would evaluate a primary care doctor: years in practice, hospital affiliation, insurance accepted, general reputation. These are reasonable filters for routine care. For foot and ankle conditions that haven't resolved, or for cases involving the surgery, wound care, or possibly limb salvage, they're not enough. Foot and ankle medicine has a significant specialization gap that's invisible from the outside. Not all podiatrists hold high-level surgical certificates. Not all of them offer minimal invasive techniques. Not all of them have training or a referral network to address complex vascular, neurological, or reconstructive cases. The gap between a generalist who treats foot complaints and a specialist trained in surgical reconstructive, limb salvage, diagnostic first workups is wide, and nothing in that review platform tells you which side of that line you're on. Over half of the lower extremity amputations performed on diabetic patients happen without a complete vascular testing. The specialist who recommends the amputation had a good reputation. The patient left reviews. Nobody in those reviews mentioned that the foundational diagnostic workup was skipped because the patients didn't know it had been skipped. 3 markers to confirm before you book any foot or ankle specialist in South Orange County. First, high-level board certification in the foot and ankle surgery. This designation requires dedicated surgical training, a formal case log, and board examination. It's publicly verified. Search the provider's name on the website before you book. This is the clearest objective signal that the surgery's training was concentrated in this specialty. Second, minimal invasive surgical options. Ask the practice directly whether they offer minimal invasive techniques for the condition you're dealing with. A specialist with current techniques can discuss what same-day weight bearing looks like for your case, what recovery realistically involves. If the answer defaults to cast and crutches without discussing any alternatives, you may be talking to someone whose surgical repertoire hasn't kept pace with what their specialty now offers. Third, direct access to the physician between appointments. For foot and ankle conditions, things change between visits. Wound appearances shift. Pain patterns change. New symptoms emerge. A specialist who's genuinely invested in an outcome doesn't disappear behind a portal for 2-day callback windows. Ask whether you can reach the doctor directly. The answer truly reveals the practice relationship and how it's structured, not just how it's presented on the website. These 3 markers cover what to look for. The last section turns this into a step-by-step process you can actually run through tonight. If this is giving you a clearer picture of what to look for, subscribe before you keep watching. This channel covers foot and ankle conditions, how to evaluate specialists in South Orange County, the clinical information most patients never get before they book. Subscribe and you'll have access to all of it. Most people spend 45 minutes reading reviews and come away with a vague impression. This process takes less time and produces actual information. You'll know 3 specific things about each provider you evaluate, things that predict clinical quality, not just office atmosphere. Step 1. Go to the board certification website and search for each provider you're considering. Confirm whether they hold the certificate. It takes about 2 minutes per provider and gives you a hard data point that no review site provides. Step 2. Go to each provider's practice website. Look for specific language about minimal invasive surgery and active recovery. If the site describes modern techniques and realistic recovery timelines, there's a signal that this practice has invested in current training. If the site is silent on these approaches or only describes traditional open procedures, ask directly when you call. Step 3. Call the office and ask one question. Does Dr. Rambacher give a patient a way to reach him directly between appointments? At Podiatry Hotline Foot and Ankle, the answer is yes. Dr. Rambacher gives patients his personal cell phone. He stays in the exam room until every question is answered. That level of access isn't standard, and it signals the care model for the entire relationship. Step 4. If your situation involves a wound that isn't healing, or a recommendation for amputation you're not sure about, or a foot and ankle problem that's been treated and hasn't resolved, call Podiatry Hotline and ask for a consultation specifically. South Orange County patients and patients from anywhere in the country facing a potential amputation can reach out directly to Dr. Rambacher, and he'll give you an honest clinical opinion about what options exist for that situation. Reviews tell you if a practice is worth considering. 3 clinical markers tell you whether that specialist is right for your case. High-level board certification, minimal invasive surgical options, direct access between appointment. Those 3 things separate a provider who's good at patient experience from one who's built to handle complex cases. You can confirm all 3 tonight before you book any. If you're still in the process of finding the right specialist in South Orange County, the previous videos on this channel walk you through exactly which questions to ask before you book. It covers what board certification means in practice, what to expect from a consultation with a real foot and ankle specialist, and how to know whether the provider you're considering has the training your case actually requires. That video is already on this channel. Watch it next.